Hello, good morning. Today we are going to discuss from your camera point of view. You can see directly the Norma basalis, how exactly the basal structure of the skull seen, and in that the Norma basalis is divided into three parts like anterior part, middle part, and the posterior part. This is what the anterior part, and from here to here it is the middle part, and here to here this is the posterior part of the Norma basalis. Now we will discuss what are the bones, sutures and foramina present in the anterior part of the Norma basalis. We can see here this is the alveolar process of the maxillary bone, and these two which the palatine process of the maxillary bone, and as we go posterior we can see the horizontal plate of palatine bone. And now coming to the sutures, the intermaxillary suture we can see here between the two palatine process of the maxilla, and as we go posteriorly this is the interpalatine suture between the two horizontal plate of the palatine bone, and also palatomaxillary suture we can see here between the palatine process of the maxillary bone and the horizontal plate of the palatine bone. Now coming to the foramina, here we can see the incisive foramina anteriorly. As we go posteriorly we can see the two greater palatine foramina, and behind that greater palatine foramina lesser palatine foramina also we can see, and there is a confusion between the greater palatine foramina which is present in the palatine bone, not in the palatine process of the maxillary bone. Either side two palatine crest with meet each other at the median plane. Here this point is called as the PNS or posterior nasal spine. Now we will discuss middle area of the Norma basalis. From the posterior part of the palatine bone anterior to the foramen magnum, what we can see, this is the middle area of the Norma basalis. We divided it into, this is the median area and this is the lateral area. This is the median and this is the lateral area. Now coming to the median area, what are the things we can see in the median area? We can see this is the posterior border of the femur bone which articulate here. This is the inferior border articulate with the palatine bone, and the superior border which divides into two ala. This is one ala we can see here. This is the like a V shape. This is the two ala, and it is articulate with the rostrum of the sphenoid bone. The structure, the superior part of the femur bone articulates, it is called as the rostrum of the sphenoid bone. Between the vaginal process of the sphenoid bone and the ala of the femur bone, one canal is present, that is called as the humerovaginal canal, and another one, that is palatovaginal canal, also present between the vaginal process of the sphenoid bone and the sphenoid process of the palatine bone. The bar which is present in the medial plane just anterior to the foramen magnum, this is called as the pharyngeal tubercle, and this is attached in front or anteriorly to the sphenoid bone. Now we will discuss what are the bone structures present in the lateral area of the middle portion of the Norma basalis. We can see two processes of the sphenoid bone, that is greater wing of the sphenoid bone we can see here, and also the pterygoid process of the sphenoid bone, and three processes of the temporal bone. One is squamous temporal bone we can see here, and this is the petrous temporal bone we can see, and the tympanic plate also we can see. And The pterygoid process, we can see this is the pterygoid process, which is projected downwards from the junction of the greater wing of the sphenoid and the body of the sphenoid bone, and it projected downwards and divides into two plates, which is this is the medial pterygoid plate and the lateral pterygoid plate. Anteriorly it is fused. Here we can see anteriorly it is fused, and posteriorly it has two free borders, and the fossa between the medial and the lateral pterygoid plate, that is called as the pterygoid fossa. The pterygoid process in its anterior border, we can see this is the anterior border. It articulates with the medially, it articulates with the palatine bone, and laterally with the posterior border of the maxillary bone by the pterygomaxillary fissure. We can see this by the posteriorly, laterally by the posterior border of the maxillary bone by the pterygomaxillary fissure, and that is about the anterior border, and posteriorly it has free borders. It has free borders. About the pterygoid plates, which is the medial pterygoid plate and lateral pterygoid plate, which is projected downwards, and these both plates having the two surfaces, the medial surface of the medial pterygoid plate and the lateral surface of the medial pterygoid plate, and the medial surface of the lateral pterygoid plate and the lateral surface of the lateral pterygoid plate. Now come to the infratemporal surface of the sphenoid bone. We can see this is the infratemporal surface of the sphenoid bone, and this is the anterior margin, and this is the anteromedial margin, and this is the anterolateral margin. Anterior margin forms the posterior part of the infratemporal fissure, and anteromedial margin continues with the pterygoid process, and the anterolateral margin forms the crest of the infratemporal. As we come posteriorly, here we can see this is the posterolateral margin, which is articulate with the squamous temporal bone, and here you can see this is the posteromedial margin, which articulate with the petrous part of the temporal bone. Now we will discuss foramina present on the sphenoid bone. We can see this is the oval shaped foramina, which is present posterolateral at the upper border of the posterolateral to the lateral pterygoid plate. We can see this is the foramen ovale, and just posterior to this foramen ovale one more foramina, that is called as foramen spinosum, and a groove which is present between the posterior medial margin of the sphenoid bone and the petrous part of the temporal bone, that is called as sulcus tubae, which runs posteriorly and lies within the auditory tube. And this is the inferior surface of the petrous part of the temporal bone, which runs medially and forward. Medially, it runs medially and forwards, and it is situated between the basi-occiput and the sphenoid bone, and it is triangular in shape, and its apex is pierced by the upper end of the carotid canal. Here we can see this is the lower end of the carotid canal, and the apex is pierced by the same canal that is called as the upper end of the carotid canal. This is the foramina lacerum, which is posterior-laterally. It is found by the apex of the petrous part of the temporal bone and medially by the basio-occiput and anteriorly by the root of the pterygoid process and the body of the sphenoid bone. And here we can see this is the triangular plate which is called as the tympanic plate, which is situated between the squamous and the petrous part of the temporal bone, angle of the squamous and the petrous part of the temporal bone. And this is the anterior surface which helps in the formation of posterior border of the mandibular fossa. This is the posterior surface of the tympanic plate which helps in the formation of anterior wall and floor of the external acoustic meters. And also we can see the styloid process and the here we can see this is the mandibular fossa or articular fossa, which the condylar head of the mandible which articulates here to form the temporomandibular joint. Now we will discuss another part, that is posterior part of the Norma basalis. In that we will discuss median part. This is the median part and this is the lateral part. In the median part we can see a largest foramina of the skull which is called as the foramen magnum, and it is wider posteriorly than anteriorly because these two structures called as the condylar part of the occipital bone which overlapped anteriorly. That's why the anterior part is narrower than posterior part. And here this is the crest area which begins at the posterior part of the foramen magnum and going backward and end at this point. This is called as the external occipital protuberance, which is the end point of the crest of the occipital crest. And also we can see this is the superior nuchal lines and this is the inferior nuchal lines. We can see clearly this is the inferior nuchal line and this is the superior nuchal lines which runs laterally and backwards. Here we can see which runs laterally and backwards. And this is about the median part of the Norma basalis. Now coming to the lateral area. This is the lateral area and here we can see this is the condylar part of the occipital bone which articulate with the atlas vertebra to form the atlanto-occipital joint, and anterior to this one foramina is present, that is hypoglossal or anterior condylar canal, occasionally posteriorly also present, that is called as a posterior condylar canal. Lateral to this part there is jugular process which helps in the formation of the posterior wall of the jugular foramina. This is called as the jugular foramina. Jugular process helps in the formation of the jugular foramina. And here we can see this is the mastoid process which projected downwards, which located just posterior lateral to the stylomastoid foramina, and anterior to this stylomastoid foramina the process called as the styloid process is present. Thank you.